2 years ago, Carson's spine looked like this. As she grew, she would have had a high likelihood of a more severe curve. Carson avoided surgery, and today she does cartwheels, climbs on the jungle gym, and runs freely. She will likely avoid some medical issues later in life because she was diagnosed and treated as a preteen at Akron Children's Hospital. Carson's treatment did not include surgery, but the regimen prescribed by her medical team stopped the progression of her scoliosis and empowered her to grow into an active teen. Hello, I'm Dr. Bono, one of the orthopedic physicians at Akron Children's Hospital Spine Center. Our spine is crucial to so many functions of our body, from mobility to lung function. The sooner that issues like scoliosis or curvature of the spine are found and treated, the sooner long-term damage can be prevented. We've assembled a team of specialists that deliver a comprehensive spectrum of both non-surgical and surgical treatments for patients of all ages, from birth to young adulthood. We believe that surgery should be a last resort, so we start with innovative, non-surgical therapies that have produced outstanding results. When surgery is required, our team brings experience, precision, and wisdom to your child's case. That's why families around the region rely on our Spine Center of Excellence. In the next few minutes, you'll learn more about our approach to spine curve diagnosis, treatment, and restoration. We work closely with primary care physicians who often are the first to spot scoliosis or other conditions during routine checkups. They refer patients to us so we can put our tools and knowledge to work. Akron Children's Hospital was the first children's hospital in Northeast Ohio to install an EOS machine, which produces 2- and 3-dimensional images at ultra-low doses of radiation. This means we can take scans as often as needed with minimal risk to our patients. Our examinations are comprehensive, and we involve specialists from other departments as needed. Not so long ago, surgery was the go-to answer for spine issues. Today, we deliver hope for improvement without surgery. Of course, treatment depends on the age of the patient and the severity of the condition. For example, mild curvatures in young children can be treated with a variety of braces. While braces do not cure scoliosis, they can slow the curve progression during crucial years of growth and development. Children diagnosed with a significant curvature at a young age could be treated and potentially cured with a metacast. The casts are changed every 6 to 12 weeks over the course of a year or more. We've made this process easier for parents by offering waterproof casts, so you can bathe your child during the process. We also employ a therapy called Schroth Physical Therapy for some preteen and teenage patients. This therapy strengthens weak muscles in the back and core to help support the spine. Our center is one of the first in Northeast Ohio to offer this rehabilitation technique. When combined, Schroth therapy and bracing have significant potential to stop curve progression and successfully avoid the need for surgical intervention. Our goal is to deliver as much improvement before turning to surgery. If surgery is required, these therapeutic techniques often can reduce the extent of the surgical procedures. If surgery is required, your child will be treated by specialists who focus only on children with spine issues. We use advanced methods and technology. If your child's curvature gets worse before age 10, magnetic growing rods may be used to direct the growth of the spine as your child matures. The beauty of this surgical technique is that once the rods are in place along the spine, they can be lengthened over time externally using magnetic technology, so there's no need for multiple surgeries. Once sufficient improvement has been achieved from magnetic growth rod therapy, your child's implants are removed and exchanged for a spinal fusion. If spinal fusion or other operations are required for your child's severe case, rest assured that 2 surgeons are routinely present for all spine surgeries. This significantly increases the efficiency of the procedure and safety for your child. When needed, a 3D imaging and navigation machine can be used during surgery to improve precision. Whether treating through non-surgical or surgical means, you can be assured that your child is in the best hands. We care for your child as if we are caring for our own. Your child's diagnosis of spinal curve can make you feel anxious. The teams at Akron Children's Spine Center are committed to guiding you and your child through this journey. The process of spinal correction and rehabilitation can be lengthy, but the rewards are great. Picture a day when you meet with a specialist and see firsthand your child's improvement after treatment. Picture a day when your adult child says to you, "Thank you for taking care of my back when I was a kid." Picture a day when you watch your child running, playing sports, or just enjoying life with the confidence that they are strong. The team at Akron Children's Hospital Spine Center is ready to help your child get back to doing the things they enjoy. Thank you for trusting us with your child's care. To learn more about our Spine Center and see how patients have benefited from our approach, visit akronchildrens.org/spine.